The Siouxland Surgery Center and Mercy Healthwatch on KMEG 14.
Diabetes can really affect your health if you don't manage it. It can delay healing, causing infection, and it could even lead to amputation. Siouxland News reporter Katie Link went to the Mercy Advanced Wound Center to learn why these things happen and what people with diabetes can do to stay healthy.
So one of the major things that we see with the people with diabetes is the higher the blood glucose, which is usually measured by their A1C or a daily finger stick. The higher the A1C, the more difficult it is to get a wound to heal. Most studies show that an A1C over 8 is a risk factor for delayed wound healing.
Michael Garrett is a nurse practitioner at Mercy Advanced Wound Center. He says keeping your blood glucose in check can reduce or save you from many complications.
Diabetes also affects the vascular status of the patient. So just like stroke risk is 2 to 4 times greater with diabetes, wound healing is greater with diabetes related to blood flow.
Each secondary effect of diabetes plays on the next. Without proper control of your glucose levels, a simple wound could turn into something life-threatening.
The thing is nerve damage. We talk about diabetes and neuropathy, and one of the things is diabetics in uncontrolled states over a long period of time lose their protective reflexes. So they can no longer feel something on the bottom of their foot.
Without feeling in your foot, injury can happen and become worse without your knowledge.
For instance, if you had your best round of golf and you put your golf ball in your shoe so you can use it the next day, when you put your shoe on, unless you remembered the ball was in there, you wouldn't be able to feel your shoe. We actually had a patient like that who came in with a black toe because he forgot the golf ball was in his shoe when he went to play the next day. He didn't feel it.
Once a wound is formed, the risk of infection greatly increases.
When diabetes is uncontrolled, it increases the risk of infection. Infection is worse when it involves a bone or it's over a joint. If those infections cannot be reversed or treated adequately with antibiotics, it does lead to a higher risk of gangrene and amputation.
Garrett says with such high risks at stake, working with your team of doctors to control your diabetes should be priority. For Siouxland News, I'm Katie Link.